We're on. All right. I'm Jonathan. I am in my little study box truck because I'm going through human anatomy, origin, insertion, activation, and what it all attaches to and how it's innervated and what the blood source and blood flows and the venous structure is and all that stuff. Super cool. But I just want to take a moment because I've had some really good questions lately, and I think typing them doesn't do justice as responding. And so this is my short, quick answer. Have I ever had a biopsy done? Have I ever had it tested? And the answer is yes and no. 12 years ago, I had a tumor in this area. It was up higher between my jaw and my skull. And I did a needle biopsy at that time because I wasn't educated. I didn't do my research and I trusted the doctors. I now have done the research, and the success rate for needle biopsies is so low. I'm not a gambler, and it's so low, I would rather go spend the money on lottery tickets than trusting a needle biopsy. That's my take. You do your own research. But back then, I did the biopsy. I trusted the results because they were not, I didn't know anything. But I'm telling you, go do your research. Find out how accurate are those needle biopsies, because they're not very accurate. And so I did that. And then when I had the tumor removed, they did a literal lab biopsy. So they take the tumor, they cut it in half. I got to put my hands down because I'm too close to the camera. And as they cut it in half, right there, they split it. And when they look inside, they can identify the exact tissue type. And it was benign. So the needle biopsy said it was benign. The tissue, it did say it was benign. And that's how I lived my life. I didn't change anything. So boom, flash forward. I have been doing this for not quite 2.5 years. And the reason I chose a natural cancer therapy is because the surgery didn't fix this the first time. In fact, I now, this will be a better update later, I now have not just 1, 2, 3, 4, 5, but at least 7 tumors in this area. Now, the beautiful thing is, they're not growing. To the shock and awe of the medical doctors, they're not. The bigger ones are still increasing about 10% over 6 months, but that's very low. It's a very low growth rate, and so I'm planning to just continue to do what I do. However, we did discuss having one removed and looking at it under a microscope, because if you can identify the tissue type that you're dealing with, then it's more discernible, it's more beneficial to then take and make a detailed plan for how to recover the body. And there's tons of tests that go into that, but that's so I chose this go around. I don't want the needle biopsy because it was basically useless. This one happens to be so skin bound, like it's only 4 or 5 millimeters deep. It'd be easy to remove. We did talk about that. I'm praying on it. Because if the Lord wants me to just keep it in there and keep dealing with it the way I am, I'm good with that. But come December, I would have an opportunity to have one removed. We can take a look at it, look at the tissue type, and then know how to deal with the other 6 remaining, maybe a little bit better. So that's kind of how I would answer this in 4 minutes or less. Now, the next question is, what about lymph nodes? Lymph nodes do get backed up. And in my case, I was so toxic, so nasty toxic from all kinds of chemicals, plastic chemicals, gasoline chemicals, pesticides, herbicides, and fungicides. I grew up on a farm, and we used all kinds of those. You would know them as like Roundup. Roundup is a pest or herbicide. Then you have fungicides to protect against funguses, and then you have other chemicals to prevent the bugs, right? Pesticides, herbicides, and fungicides. So my body was loaded with those, sick, just nasty sick. On top of all of the chemicals from racing motorcycles for 27 years. And between all of that and a disability, I guess kind of, we could say that, a disability to digest protein properly, probably since I was 3 years old, I did not have any tryptophan in my body, which is like the fundamental building block for tissue. It helps you break tissue down and it helps you build tissue up. So when all of those things, like basically my sewer system of my body, your lymphatic system is your sewer system. It gets rid of all of the waste products from your tissues, from your cells, from your muscle functions. It all goes out the lymphatics and then filters through your kidneys and liver. So with me being so toxic, it basically disabled, really limited my liver function. It really limited my body's ability to detox. And as a result, from a naturopathic standpoint, all of my sewer system, the lymphatics, backed up. They can't clear, and it starts to build tumor tissues to protect itself. So the question is like, well, what happens if you get some lymph nodes that are hard and they're puffy and they're painful? That happens. That absolutely happens to people, and there are things you can do to help your body. If you're doing a natural route, look into castor packs, because you can put a castor pack, and castor, C-A-S-T-O-R, so it's a castor oil, very inexpensive. I am not a doctor. I'm not giving you medical advice. I am not suggesting this is the cure-all bar anything. That's not what I'm saying. What I'm saying is it will help your lymphatics. It will aid in their process. And as a result, I keep pointing because I have a lymph node that's here under my chin. And when I am backed up and I need lymph support, I will use a castor pack. I will also use a glutathione, liquid glutathione that I take liposomally under my tongue. So it's like a liquid that you put under your tongue. And I do that a couple times a day, and it'll clear out that lymph node. It gets sticky sometimes, and I do have to do things daily to maintain that. If I don't, it will back up and cause me more troubles. And there's more to that, but I'm going to kind of leave it at that. What happens when you have sore lymph nodes? You might have them all over here. They're all over here, but they're kind of concentrated here. And an easy way to kind of loosen things up is right below your clavicle. So you've got your clavicle bones there. If you can kind of push like that about 40 times and then you look up lymphatic massage. You do this, you can work your way up. You can go like this and work that lymph out. It'll help clear that pathway. Now, 75% of the lymph flows through your left breast. And so for women, typically when they have breast problems or lumps in their breast, it shows up in that left breast because of that. The lymph, all of the lymph flows through there and through your left breast. So you might feel it built up under your armpits, axillary area. And if that's the case, you just need some lymph support. Another really easy lymph support is it's just rebounding. Get yourself a little trampoline, do like 3 minutes in the morning, get used to it. Just, you don't really have to jump. You just kind of bounce, just bounce. And it'll work that lymph loose, and then do it in the evening before bed. It really makes a difference, and it's so easy to do. Another thing you can do is dry brushing. So you should look up videos on dry brushing if you're kind of trying to work lymph out. There are other things like herbs like phytolacca that you can use to do so. There are also teas. There's detox teas, dandelion teas. All of those things will support your lymphatic system. Milk thistle is another herb that is marvelous. I take milk thistle like 7 times a day. All of those things help clear the pathway, help you clear out your lymph. And once you get to feeling well, then you have an idea of what it feels like. And then when you have a day where you're like plugged up, I'll give you an example is I had to paint all of the trim on my house. And as I'm doing that, I'm inhaling the VOCs, the volatile organic compounds, off of the gas, right, off gassing from the paint. And as a result, I don't feel good, like migraine type headache. Turns out a lot of headaches are 1, because you don't have enough water, and 2, because your lymphatics are all backed up. And if you can support them via some of the things I mentioned, if you look into it, A great doctor on YouTube is Dr. Berg. Check him out if you're looking for lymphatic support, or Dr. Axe. Both of them, great fundamental natural approaches to supporting your body's lymphatics, and that should help you. I hope. Have a great night.